Robert Sandstrom, with a PT degree and PhD, defines autonomy as a negotiated social contract between a profession and policy elites based on the public trust in a profession to act in the best interests of the society. Mark Cast, owner of a physical therapy clinic with a PT and MPT, says that right now in most states, people need a prescription from a doctor in order to see a physical therapist and get it covered by insurance. A survey by Snow et al. Found that 67% of South Florida residents did not know about direct access to PT, but 73.4% of the 162 respondents indicated they would go to a PT for an evaluation first if covered by insurance. Steve Herman, Senior Vice President of Operations of a revenue cycle company, says that in some cases, people can have direct access to PT for up to 10 visits or 21 days without a prescription. And this image shows what it looks like for someone to have direct access to a physical therapist or to go to a doctor first. This is important because some people may have injuries that take a longer time to recover from, and physical therapy would be necessary to help them. Some people also do not have enough money to afford seeing a doctor first. Due to the comprehension that physical therapists have, they need recognition that they are able to perform their job properly without intervention, so that people can get therapy without a prescription from their doctor. Firstly, physical therapists need to be trusted by insurance companies to create prescriptions that insurance companies will cover. An article in the Journal of Manual and Manipulative Therapy says that the researchers found that PTs performed better than all other specialty providers, with the exception of orthopedic surgeons on a standardized musculoskeletal examination. The PTs in the study showed that they have similar amount of knowledge to orthopedic surgeons and scored higher than many physicians. Physicians can make prescriptions, but PTs show that they have enough knowledge to also do so. In a study by Richards et al., it was found that 14 out of 24 exercises were not prescribed by over half of the physicians in the study, but these exercises are used very often in physical therapy clinics and are found to be useful in therapy. By prescribing these exercises and helping patients recover, it shows that physical therapists have enough knowledge to be independent of physicians. This solution can be funded by grants from the government or organizations such as the APTA that can allow insurance to cover more visits. A quote by Johnson and Abrams says, "With the passage of state practice acts in the 1950s, physical therapists began to be regulated, in much the same way as physicians, through a state licensing board." This acknowledged that physical therapy is a professional career and further compares the amount of knowledge they have, and it is just up to the insurance companies to respect that and allow people to get direct access and get their appointments covered. This diagram shows the difference between physiotherapists and physical therapists and the education requirements for both, and it shows that they each have to pass the same exam. The second solution that can be done is more lobbying for physical therapists. This includes joining organizations and getting involved in the government policymaking. In 1991, two bills were being examined. The bill for the nurse practitioners was sent into law, but the bill for the physical therapists was not. Since physical therapists already have enough practice to prescribe therapy, the main issue between them and nurses is lobbying. If a bigger base is built for physical therapy organizations and lobbying, then physical therapists may be able to write prescriptions. This is an example of the American Physical Therapy Association encouraging people to do lobbying and even support by making donations. A quote by Washington et al. Says, "Some physicians serve on committees vital to the enactment of health policy legislation, such as the House Ways and Means Committee." This is an example of some healthcare workers that are in legislation. Joining committees and getting involved in policymaking can create a more favorable outcome when it comes to getting bills passed. Lobbying and getting involved does not have to be a financial burden besides paying to be part of an organization. A third solution to the issue of autonomy is by just going back from a DPT to an MPT degree. An article in the Journal of Physical Therapy Education states proponents of the DPT maintain that a doctoral degree will speed the development and acceptance of autonomous practice through an image building process that will augment public recognition. The purpose of the DPT to push for autonomy has not been reached. This means that we can take away education expenses and extra classes that aren't being used, such as how to use an X-ray. Johnson and Abrams state, within the physical therapy profession's development, there has been the acquisition of effective skills for practicing interdependently with physicians and other providers. This table shows a questionnaire of how physicians feel about physical therapists. Most physicians feel that physical therapists are useful when they help with their specialty. To gain autonomy for physical therapy, insurance companies should be able to trust physical therapists. Health workers should take part in lobbying. And a third option to solve this problem is no longer requiring a DPT due to the access knowledge not being used. People need therapy to recover, and autonomy will be able to give a larger amount of access for them and give therapists a higher amount of control.